Good evening and welcome to our ninth Rolf session here at Balance Orlando in Orlando, Florida. We want to thank you for coming in this evening. And as always, I want to introduce my client, Debo. And as you know, last time we worked on Debo's lower body. Today, Rolf session 9, we're going to continue the integrative session and work the upper body with a little bit more movement than normal. And so I'm going to ask Devil how you felt after our session several weeks ago.
Um, I feel like I'm moving a lot more easily and feeling like just feeling like I'm in better shape, which I think comes with being more aware of what's going on with my body and being able to move it so much more easily.
And I really appreciate from the comments we had before the camera rolled that you're still going to the gym
Yep.
and you're still walking and you're able to take the results from this room and then apply it even the next morning at 6 o'clock in the morning.
Oh yeah, and that's the thing. I walked all the way home from like the Orlando Museum of Art all the way to my house, which is a pretty long walk. It was like a 30-minute walk, and it was so nice.
Excellent.
Yeah.
Excellent. You were mentioning before you did a workout
Oh,
earlier
oh,
today.
yeah,
So
yeah.
tell us about the workout
So,
and
but it
what
was
we
an
should be.
upper body thing, not a lower body thing. But yeah. So I can do chin-ups now. Like I can do two without just straight, off the ground chin-ups, and then I can do usually like one more if I get a little hop in. But that's a pretty big accomplishment. It's not a sexist thing. Women are challenged when it comes to chin-ups, and so
Okay,
that's like
some women
huge.
are challenged.
Yeah.
Okay. Would you say that there's any, that was several days ago.
That was this morning.
Okay, so there might be some tightness
Yeah.
in the chest. Okay, all right. So what we're going to do today is instead of a walking analysis, I'd like to just to see what you're like standing. And I'm going to take some notes. So I'm going to have you stand in our usual position,
Facing you or like
first facing, and we're going to place our feet hip width apart.
I always mess that up. My trainer also corrects me on that.
What is the what
She
do you usually do?
I usually stand with them too close, and
Mhm.
then she'll correct me also.
Okay. Just a note to our viewers, anytime you're having a backache or it's been a long day, take a wider stance in your base. It starts to take more weight off of your legs and it just relaxes your core muscles from your abdominals to your upper thighs, your groin, your lower back, and your buttocks. So thank you to your trainer for giving you that cue. So we're just standing, and the first thing I'm looking at are Debo's hands. They're in a neutral position. One hand is not more forward than the other. This is good. Then the second thing we're looking at is assuming the jeans are well built. We're looking at the zipper, and we're going to go up to the umbilicus, to the linea alba, to the cleavage, the sternum, and then to the chin. And everything is pointing, or everything is in alignment. That's a good thing. I also like, and what I'm also looking at is how much space we have between the left arm and the right arm to the ribs. That's good. Sometimes what you'll see in clients is one side it's more straight in terms of uh, this crease here between the last rib and the hip. One side might be more straight and the other might be more curved. That is not the case here. Looking at the bra is horizontal. It's not one side is higher than the other, and that's good. And finally, I'm looking at the clavicles. The clavicles are almost horizontal. There's a slight, just from anatomically speaking, a slight angle. I like that. Finally, we're going to have Debo face the mirror, and the feet again are at hip width apart, and we are imagining a plumb bob that starts at Debo's ear, then goes to the lateral deltoid, elbow, the greater trochanter of the femur. And I like that she has a slight flex in her knee. And then finally, the ankle. If you ever are experiencing back issues, lower back issues especially, check yourself when you're standing. Am my knees locked out? If they're locked out, put a little flex in them and pretend like you're sitting on an imaginary table. And also take a wider base in your feet, and that should help to alleviate, excuse me, your lower back pain. So looking at Debo's structure, I see a lot of horizontals, and this is very good. I see a lot of horizontals, especially first and foremost in the pelvis. Excellent. See horizontals in the chin. I would say we're about at 98% where it's just like on point. To get it to 100%, because sometimes I can be a perfectionist, is to slightly lean back.
But yeah,
and
definitely, I think I have that habit of kind of
slightly taking your pelvis forward.
yeah.
Okay, so we're just right here, and oh, that is excellent. But the ear still is, being a perfectionist, slightly like a half an inch, a third of an inch more forward than I'd like it to be. So I'm now going to have you face the door, and I'm going to palpate the shoulders, and the shoulders are moving very well. I'm going to work with the rhomboids so we can even retract the shoulders even more. And when that happens, the shoulders will come back a little bit and more forward. And then for equilibrium, the head will come back. So that is my goal. And now Debo will come on the table and we'll lie face up. Okay, Debo is on her back. And while on her back and while the camera was off, I had Debo to put her hands to the side, and I just gently pressed into her shoulders, and noticed that the right shoulder was easier to push down into the table than the left. I also palpated the back of Debo's shoulders when she was standing towards the door, and also felt that there's a lot more tightness in the left rhomboid as well as the left infraspinatus. So that means we're going to work on the right side first. And again, my goal is just to lengthen and integrate both arms back into the spine. It's pretty easy to get into the connective tissue, into the fascia of Debo's right lower arm. I'm going to do that just one more time. A little bit more pressure and a little bit slower. Just checking for pronation in a neutral position, and you can see that for the most part, Debo's hand is, for the most part, neutral. There's a slight pronation. Do you do a lot of office work or
Yes.
computer work, I should
Yes.
say? Okay.
So at least 75% of my job. That's also the hand I use for, doing stuff on my phone more. I try to use my left thumb, so I'm not using my right thumb too much, but it's just easier because I'm right-handed.
That's a good point you bring up. There are so many people who are conditioned to doing things with one way. For example, holding a baby always on their left side. And then, although the baby might weigh 10 to 20 pounds, the body will overcompensate most of the time and will raise the left shoulder higher than the right. And then the head then will tilt to the right. So I'm glad that you are aware that you are using your right thumb a lot and are at least trying to make a change. So there's less tightness in your hand. Okay. One of the next parts we're going to work on is your right tricep. Good, a lot smoother, a lot easier on that last stroke. And now I'm going to have you to place your hand, your right hand on your head, just like that. And we're going to extend the elbow or take the hand to the ceiling.
The hand, like that.
There we go. Yes. Good. And come on back. Remembering that the tricep, tri meaning three, there are three muscles. Of the tricep, and I want to work and access every single one. Any soreness or tightness here?
It's a little soreness probably from this morning.
Okay.
But it's nothing uncomfortable.
Good. Just a couple more times. Two more times. And hold it right there. Any soreness or tightness right in the back of your shoulder.
No.
Okay. Gently come down. I call this going down the Nile or Mississippi River. I'm going between the bicep and tricep. Very smooth. No rocks or bumps on our journey. Now I'm going to work on the infraspinatus. Let's just put my fingers right in the middle of your scapula. And this might be a very ticklish or somewhat sore or painful. Which one is it?
It actually feels really good.
Okay. When you were standing and facing the door, there was a little bit more pain while I applied pressure to this muscle, the infraspinatus, but there was more movement.
Right. I mean, I guess it hurts a little bit, but it's that good kind of hurt that you get when you get a good deep tissue massage. Oh, feels like you're releasing it.
Releasing it, okay. Thank you. I just want you to have a little bit more range of motion. So when you're taking your hand over your shoulder, you're using all your rotator cuff muscles, and I'm working on one of them, the infraspinatus. So it might be a little hard when I go over the head or over the shoulder. Just a couple more times. Excellent. And come on back down. Good. I'm now going to work with the rhomboids. Remember, Devil's head is, because I'm a perfectionist, is slightly like a half an inch more forward than where I'd like it to be. I want to kind of wake up those rhomboid muscles between the spine and the medial border of the scapula. Now, when you're at the gym, do you ever do any resistance exercises, any tricep uh, pull-ups?
Yeah, I mean, again, we do different things every time, but some of it is, we use, do pull-ups, we'll use the TRX and kind of do, like flies where rather than having weight, where it's like I'm using the TRX to push myself
Okay.
back up.
Any soreness when I come from the spine to the scapula?
Again, it feels like that really good deep tissue massage kind of feeling.
Okay. So take a nice inhale and exhale. Good. So I'll wait for the exhale to take my hands just inside or just lateral to the spine, all the way to the medial border of the scapula. And 2 more times. Inhale and exhale. Good. And last time. Inhale and exhale. Good. I want you to take your head to the left. And while you take the head to the left, I'll give you a snow angel. You're going to come back with your head. And we'll do that 2 more times. 1. And look how well Devil's head turns to the left. You can clearly see her right sternocleidomastoid when she turns all the way to the right. Come on back. Now just gently, you might be a little ticklish, so I'm going to let you give you fair warning. I'm going to work inside the armpit, and I'm right on the latissimus dorsi attachments, and this is like butter. Super easy to take Devil's hand back. There's no resistance. I'm happy. Now what happens on the other side, on the left side, is a different story. Now I'm going to place my hands underneath the chest. Do you remember 10 years ago when you were first Rolfed by Lou?
Oh God, it was like this.
It was just like this. Okay. So I'm not feeling any tightness, any soreness as I take the hand back.
She wasn't as patient with me as you were.
Okay. And it's very good. So we're going to come back again. I just want to just gently work the lower arm. Okay, now I'm going to work on your right side. So we're going to, in a couple moments, gently to turn on to your left side. Devil is on her left side, and we will thus continue working on her right side. I always like to work on my client's levator scapula, both on the occiput, which is the proximal attachment, and also on the distal attachment. It attaches right here at the superior angle of, or the upper angle of the medial border of the scapula. And as I go underneath Devil's right medial border of her scapula, there are no tight spots. It feels very hydrated. I'm just loosening up the connective tissue even more. What Devil could do is do some resistance or add some resistance stretching exercises to her routine where she's really strengthening the rhomboids so that the shoulders, especially the left shoulder, will start to come back. So as we know from our first 8 sessions, the rhomboids help to retract the scapula, and we typically can do this when we're doing a jumping jack from our starting position to about 65, 70 degrees before the upper trap takes over when we take our hand above our head or above our shoulder. Any soreness, any tightness? Feels very hydrated. Good. You're going to place your hand by your chest, and I want you to extend your hand to the wall about 4 times. And I'm now just working on the infraspinatus muscle, really trying to liberate and hydrate that connective tissue. Good. And last time. Awesome. And I'm feeling very little resistance right in the levator scapula as it then becomes the rhomboid. This is very good. I'm happy, so we're going to hang out and relax here. And since I have you here, I can work on your hips. So I'm just giving you fair warning. Now you're probably saying, well, shouldn't she be in her underwear or shorts? Yes, for the most part. However, it's been my experience that cotton is pretty good in terms of me as a practitioner getting into the connective tissue compared to a lot of polyester that's on the market. So I'm just going to palpate the last rib. We're going to just scoot you over right over here. Good. I don't see any skin folds, so that tells me there's no rotations I should be too worried about. And we also saw that the umbilicus was right in the middle of her body, so I don't have to worry about that as well. So no rotations in the pelvis. And I'm just seeing how easy it is to take the hips into an anterior tilt and posterior tilt. There's only one tightness right there, and it looks like that's more gluteus medius and a little bit of a maximus. So we're going to do the clam shell where the heels are together, and you're going to gently raise up and come back down. Just about 3 or 4 inches. Good. And again. As you know, the gluteus medius is a great muscle. I call it the salsa, the samba, the Zumba muscle. If you ever like to do a lot of walking, it's a great muscle to really strengthen, but also hydrate so that when you get the most abduction, you get the most stride length in walking. Good. A couple more times. What do you, and you're laughing, so is that a precursor to, is it painful? I'm just curious, or is it just very sensitive? Keep on going.
Very sensitive. I'll actually start to feel the pain a little bit more after the laughter subsides.
Okay. And now I'm going to have you extend your top leg, keeping the knees together. Just like that. Good. And come on back.
But to be clear, the pain is not, again, it's like a good workout.
Okay. So we saw in a side view that Devil's hips were level, which is one of the major goals of Rolfing. That doesn't mean that the buttocks is not tight. It's just only the upper part of Devil's glutes that are just slightly tight. And just 2 more times. 1 and 2. Thank you, and relax. We come back. Much better. The only place of tightness I feel is right there. And there's so much movement in the hip that compared to most people, you can easily see like when you're going nice and smooth to where it gets stuck. So it's still right here. And continue to laugh, raise up. Let's do a clamshell. Good. And come on back. Good. 2 more times. Nice. And again, now if you want to take it to the next level, you could ask your client to take her knee into her chest. Good. And she's doing all the work. I've already palpated where the tightness is. Excellent. We're going to do 3 more. Here we go. Remember, a tight buttocks, tight gluteus maximus medius means a less efficient stride, a shorter stride, a more strained walk. We're going to do 1 more. I know I can't count. I say 3 and I really mean 5. And last time. Good. Come on back. Raise. Repent. Much better. Even this spot here that was tight, a little bit tight.
It's tight, but I'm not bursting out in uproarious laughter.
So what we're going to do to conclude the buttocks is a workout is to extend the leg. Exactly. And can you tell the audience, is there a soreness or tightness?
Definitely tightness. It's a little bit tender, but it doesn't hurt.
Do it 2 more times. So my last couple strokes on Devil's gluteal muscles was to really focus on the gluteus maximus. As you know, that's one of the main muscles that are used when you're in a sitting position and you stand up. I felt a little soreness, a little tightness in that area. So I asked Devil how she felt, and she was saying that it got a little tighter as I went a little bit more towards her feet as she was extending her leg. And so at that time, I stayed on that point right in the middle of her buttocks. And then we concluded. And relax. So I'm happy here. I'm happy with the right side of your body. And in a couple of moments, I'm going to have you to come off the table. And I would like you to stand for us. I said for Devil to stand. I'm also going to have her to walk. But before she walks, one thing I've learned over the last couple of months is when I ask my clients to walk, they walk like at half the pace of their usual pace and they look down. So I always like to say to my clients, walk, even if it's just for like 4 or 5 seconds, but a lot faster and you're looking forward so I can see what your normal walk looks like. So, Devil, here we go. A nice fast walk, looking forward. Okay, and come on back. Good, and last time. And last time. Very good. So she walks, Devil, and you're going to face the camera. Devil definitely walks in a sagittal plane. There's a really good abduction in the hips. While she was walking to the door, I saw a nice pendulum effect in the lumbars and lower sacrum. And while walking, as one buttocks was coming up, the other was coming down. So Everything was in proper order. I'm happy. Can you tell us how you felt? Did the right hip feel even different than the left?
Yes, yes. That was actually the whole, because also the way my arm was swinging felt different. Like the whole right side felt looser.
Okay. All right. So we've just finished Devil's right side. She's done her walk a couple times to the door, and now we're going to work on her left side. So I'm going to just do a quick test to see how easy it is to take the right shoulder down and then the left shoulder down. And so, Devil, can you tell the audience what you feel if I take the right shoulder down versus the left shoulder down?
On the right shoulder, I feel almost nothing.
Mm-hmm.
On the left shoulder, I feel it kind of pulling a little bit, and the deeper you go, it feels a little tender.
When you say there's a pulling, what do you mean? Can you be more specific?
Like it's just kind of tighter, so it's like inside.
So it's tighter in like right near the pec minor and the outer pec major.
Yeah.
And so when I do that, I feel there's more tightness right in here, right in the on the bicep, which means I need to work the tricep. So I'm going to actually have you start off here, and I'm going to work on your tricep. Okay, so now we're working on Devil's tricep as she extends her hand. Good. To the sky and back. That's a pretty good speed, Devil. Mm-hmm. I feel just a slightly more tenseness, more tightness. I'm trying to use the word tension as Devil comes up. Devil, what is your experience?
It feels tighter on this side than it did on the other side.
Tighter on the left side than the right side. Okay. We're going to do that a couple more times. And just two more times. And hold it right there. Thank you. Left forearm feels good. So you're right-handed, correct?
Right.
Okay. So this arm is even more in a neutral position. So I felt it less tight, so I don't need to do as many strokes. There's less tightness on the palm. I will still work. And there's a little tightness in the wrist. Not so much. So overall, not that much resistance.
Yeah, that forearm feels easier than my right forearm.
The left forearm feels easier than the right forearm. I would definitely concur. If anything, and this is to really almost a nitpick, there's maybe a slight soreness or a slight resistance in the wrist. But compared to the right side, it feels a lot easier. We're going to now work on, I like to call it the sweeping down the river, working in that space between the bicep and the tricep. a little tight. So that tells me we need to do a couple more tricep extensions. So we're going to place our left hand back on your head, and I'm going to have you to extend. Very good. Good, and come on back. Okay, 3 more times. Good, and very slowly the last time. Good, and come back down. We're going to go inside the axilla for the latissimus dorsi attachments. On this side, I can feel a little bit more tightness. Thank you for the breath, Debo. Can you feel that tightness a little bit more on?
Yeah, that's why I laughed more on this side. On the other side, I only laughed when you really got right into the armpit.
Good. Now we're going to work inside the chest.
Okay.
This is a note here, and I want to apologize to Debo. If Debo experiences or has experienced lower back pain in the past, you always have that option to ask the client to place their feet on the table. When you place the feet on the table, you're actually taking away the lordosis, that curvature in the lower back, flattening the back, giving you more length. If you don't have a case or you don't have a case of tight lower back, you can always extend your legs, but it's up to you.
Well, when I laugh, it's tightening everything, so I'm gonna keep them up for now.
Okay.
Especially if you're gonna do that again.
I'm going to do it for another 30 seconds.
Okay. Now I'm just laughing in anticipation.
That's good. And it's actually very good. It's very good access. A little tighter on the left side than the right. We're going to go a little bit higher. And this is quite normal for people to laugh.
Especially me.
When we've accessed the connective tissue or the fascia. Just another 15, 20 seconds.
Oh.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and one more stroke here. Good. And we come back down. Reviewing going down the Mississippi River a lot easier as we've done a lot of work inside the armpit and on the tricep. So both hands are to the side, and I'm going to have you to raise, Devil's going to raise her head up, back down, and it feels definitely a lot easier to take the left shoulder down as well as the right shoulder. Still, I mean, just like the left side
I
feels
feel
just a
it though.
little bit tighter, but compared to about 10 minutes ago.
Yeah, it's a lot less, but I do feel a little more tenderness on that side.
So the last thing we're going to do is work on the rhomboids, the left rhomboids, and the left infraspinatus muscle. So first, we're going to work with the rhomboids. So I'm going to have you take a nice deep inhale. And let's take an exhale. And I'm just scooping the connective tissue, the skin almost, from the spine on the exhale all the way to the medial border of the scapula. Just about 3 more times. So I'm going from the middle, almost towards where her chest is. And I slowly go up, and then I go back down. 2 more times. Inhale. Thank you. And last time. Now we're going to do some movement work. As I take the hand up, I want you to turn your head to the right. Very good. Come on back. And again. Good. A couple more times. Mm-hmm. 2 more times. And last time. Good. Come back to neutral. Now we're going to go a little bit more lateral. And we're going to go right on top of the infraspinatus muscle. So sometimes when I get tired, I will have my clients to do a lot of the movement. So you're going to put your left hand on your left chest, and I'm going to have you to extend your hand to the ceiling twice. Good. And again. Mm-hmm. Now I'd like you to reach for the mirror in front of you. There you go. Good. And reach a little bit higher now. Thank you. Now I want you to reach to your left. Good. I meant to say right. So I want you to go right. I apologize. Good. Come on back. And again. Now, last 3 times we're going to extend to the left as we move our head to the right. Good. Come on back. And again. Good. And last time. A little bit tighter on this left side. Devil, what is your experience?
Yes, feels tighter.
So now I've regained some of my energy back, and remember the key is not going down, but more up and over the shoulder. And just 5 more seconds. And I thank you. Last thing we're going to do is have Devil to raise her head again, come back down, and she's going to place her hands in a neutral position, and I'm going to push on one and see if the whole arm moves. Getting better on the left side. Still, there's some work to be done. And that work is mostly on the rhomboid of your left side and your rotator cuff muscles. So I'll send you some exercises tomorrow about what we can do to loosen up that connective tissue. Okay, so Devil's off from the table, and we've just worked her left side. So we're going to look at her left shoulder and left hip. We're going to walk at a little bit faster clip than normal, and you will be looking forward with a soft glance out of your eyes. We're going to walk twice, and whenever you're ready. Excellent. Let me stop here. Excellent walking. I could see the jeans, the belt buckle shift from left to right. I could see the pendulum of the lumbar and the sacrum. I could also see the hips abducting. So this is all to maximize the walking stride when walking. So let's do it again. I also like the contralateral motion in your arms as well. Excellent. Now we're going to face the mirror. Good. And the feet are hip width apart. Okay. So from here, remember we talked about how the pelvis was a little bit more forward, and one of the first things I wanted to do was to take that pelvis back. I am not inclined to do that now. So I did not work with the rectus abdominis. I did not work with the psoas major, just working the hip work, a little bit of the quadratus lumborum and the buttocks. We've taken the trigger points of tightness out of the buttocks, and it can relax, and it's going back. Okay, and you're looking forward and chin a little bit down. Very good. And now even the ear is starting to, it's like, it's almost right over the left shoulder. This is excellent. All right, so we're going to come back on the table. Debo is on her right side, and now we're going to work on the left side of her body. This is where I felt there was more tightness in the infraspinatus when she was standing, more tightness in the rhomboids, and a little bit more internal rotation in the left shoulder. And when she was laying down, when we first started, I found it harder to press this left shoulder into the table. So let's first begin at the Levator Scapula. Already, I can feel more resistance. Devil, may I ask if you've been wearing a purse or a backpack or holding a child or doing something more out of the ordinary where you're putting something on the left side of your shoulder?
I have, over the weekend, I carried a purse, but I also tried to switch it from side to side.
Very good. That's a very good habitual practice to do.
And I usually wear it across, so like the strap will be on one shoulder and then it'll cross over and the purse will be on the opposite hip. So it's not just hanging on the shoulder like.
Okay. So what I'm doing now is I'm going close to the ear, right in the back of the occiput, going towards the middle. And while I'm doing that, I'm gently taking the shoulder with my palm and taking it back and down away from Devil's Head so we can get a lot of length in the levator scapula. How's the pressure here, right on the levator scapula, Devil?
It feels good, but I definitely notice that it's more tense.
More tense on this left side
Yeah.
compared to the right side. Okay. Can we stop? So we've worked with Devil's left levator scapula from the occiput to the upper part of her left medial border of her scapula. I'm going to now just continue and just slowly go underneath Devil's medial border. And just like the right side, I feel a nice hydration. It's very easy to go underneath the medial border of her scapula. Good, and just one more time. Good. I want you to have you place your hand on your left chest. I'm going to have you to extend about just a couple times right in front of you. Excellent. And also, I feel a little tighter just in that first stroke. It's like I have to put more pressure, deeper pressure, slower pressure in that scapula, in the infraspinatus. Now I'm going to have you to extend your hand to the skeleton. Here we go. And here we go. And I'm just going to follow that path. So she's reaching for that skeleton. I'm going to take it that direction, on the opposite direction. Now, extend to the heater right in front of you. Good. And two more times. 1, 2. So now, because I know there's a slight internal rotation, I'm going to have Debo place her hand on her head, elbow not forward, but as comfortable as possible, straight forward, in line with her middle of her body. And she's going to just gently extend. I'm going to work on her rotator cuff muscles. Okay, so I'm going to just gently guide this hand. So I'm going to you extend to the window and come on back. And so by doing this and taking this elbow back, we're also taking the shoulder back to where it needs to go. This feels a little tight here.
Yeah.
Devil, what is your impression?
It feels tight. I mean, I can feel it actually extending all the way down my arm. The tightness.
Mm-hmm.
I think it's kind of pulling as I move my arm.
Just 3 more times. Good. 1. Good. 2. Very slowly. Last time. Thank you. Place your left hand on your chest. We're going to extend just 3 more times.
Forward?
Forward, yes. 1. Thank you. A lot softer now. Excellent. Good. I'm going to take the hand. We're going to go back to the levator scapula to see if there's any marked improvement. I'm feeling a lot less resistance in your occiput. And I'm going to go underneath Debo's medial border again. Even easier. I'm like even going deeper into the medial border. So this is good. Now I'm going to work with the hips. Okay, I'm going to palpate the last rib. I'm just going to see how much distance we have between the last rib and the hip. It's good. I don't see any skin folds, so I know there's some good length, and there's no rotation in the pelvis. So we're going to check for the anterior tilt and posterior tilt. And already I don't really feel that much tightness. There might be just as much sensitivity, but definitely a lot less tightness. So the only place of tightness I feel is right there. That is mostly the gluteus medius, some gluteus maximus. We're going to do a clam shell. Good. And come on back down. And again. Good. We're just going to do this about 3 more times. 1, 2, 3, and relax. Checking it again. Now it's right here. You feel the tightness here. Okay, I guess that's a yes. We're going to continue doing a clamshell. We'll do that 4 more times. 1, 2, 3, and 4. And relax. Thank you. Would you say the pressure I'm applying is light, medium, or very deep?
It feels deeper than medium, but not as deep as very deep.
Okay. Let's have you now, thank you. I'm going to have you to extend your leg, your top leg. Now I'm working primarily on the upper gluteus maximus, and I'm going to slowly go down to the middle of the buttocks. Good. Mm-hmm. 3 more times. 2, and 3. Thank you. Let's come back. Let's see how much anterior and posterior tilt. It feels a lot better. The only place of tightness is still about right in the upper part, so that's gluteus medius. This time we're going to have you extend your leg, and I'm going to come from this side, and hopefully, can you see that? Okay, we're going to extend. How are we doing, Debo? Okay, you're breathing. So this is pretty intense right now, would you say?
Yes.
Mm-hmm. Good. 3 more times. 1, 2, and relax. We'll do another check. Much better. Still a little tightness right in here. So we're going to raise up. We're going to take the knee into our chest. Very good. Good. Come on back. So come on back. Now I kind of change position. I'm on the gluteus maximus. I'm not feeling any trigger points, any tight points. So now I'm going a little bit towards the intersection between gluteus medius and maximus. Remember, tight buttocks means we can't take the fullest stride, more muscular strain. So what Devil can do, and probably she's been doing, is using a foam roller at the gym or at home or at her gym to really start to release some of these tight points. And we'll just do this about 3 more times. Good. 1, 2. Ooh, right there. That's a nice one. Good. Hold it right there. And what I like about Devil right now, she's taking a nice inhale through her nose and a nice exhale through her mouth. Good. Come on back. We're going to gently raise our knees. Much better. We test to see the last rib to the hip. There's even more space. I'm happy. So now we're going to slowly come up from the table, or better yet, so we finished the left side of Devil where we've worked with her Levator Scapula, her Infraspinatus, her Rhomboids, even a little bit of her upper trapezius muscles, the upper glutes, gluteus maximus and medius. And now in a couple of moments, we're going to come down from the table. I'm going to take the pillow from you. Devil's going to place her feet on top of the table, and we will do a Sacral Cradle, placing my hand underneath the sheet. Devil's going to raise her hips. She's going to come down, and I'm right on her sacrum. And I want you to take 3 deep inhales through your nose and exhale. And 2 more times. And Devil is not going to move at all. She's not going to raise her hips. And she's going to come slowly down. There's a lot of flexibility in how you proceed in a session. I chose not really to work on the back of the head or in the throat, as I know that session 10, which is our last session, it's our 3rd and final session of the integrative session. We're going to work the entire body, and I have some specific exercises and movement exercises for the neck, so I did not necessarily want to repeat from what we're going to do in a couple of weeks. I want to thank Debo, and as always, we're going to bring the table down. She's going to slowly come off the table, walk to the door and back, and then we're going to look at her structure and wish her a good evening. Yes, but this time you always start, most of the time you start on your right foot. Start on your left foot.
Now it's a brain exercise.
Good. Good. Excellent. Now I want you to face let's move up a little bit. And the last thing I want to do is, especially since this is the upper body session, is just to see how easy it is to take the shoulders back a lot easier without you So this is good. So that means we've really worked on the rhomboid muscles. And as you know, the main purpose of the rhomboid muscles is to retract the scapula. So that feels much better. Good. And we're going to now the, we're going to face the mirror, and the feet are hip width apart. Yes. And you're going to look forward. Nice. And in this position, the ear is matching up very well with the deltoid, the elbow. The arm is long. It's not so contracted for the biceps and triceps. The pelvis is level. Knees, there's a slight bend, and it's going all the way down to the ankle. So I want to wish you a great evening. Continue to exercise. And I'm sure you're going tomorrow to the gym. Continue walking. And I look forward to seeing you for our 10th and final session in a couple of weeks. Thank you.